Hi, everyone, and welcome to NLBP TV. This is a member spotlight with Scott Kennedy of LightPath to Wellness out of Fort Lee, New Jersey. Hi, Scott. Thanks for joining us today.
Hello. Thanks for having me.
Scott is doing an interesting technique called light energy. So I invited him on our TV channel just to talk to us a little bit about that and what that is and how it can help. So Scott, tell us a little bit about what light energy is. I think it's kind of a new concept for many people.
Yeah, it's new to a lot of people. Interestingly, it's been around for 40 years. So it was first started by NASA 40 years ago. They were using it in space and they were seeing great results. So, since then, thousands of hospitals have it. Professional sports teams are using, the U.S. Olympic team is using it as well. So it's out there. It's just, it hasn't quite caught on to the average person.
Fair enough.
So the best way to describe it, use an analogy, photosynthesis. We all know what that is. It's plants take in light energy. There's an actual chemical reaction that occurs and the plant starts to produce energy to grow, to survive. We do the same thing with sunlight and vitamin D, among other things.
Okay.
So what we do is we take light at very specific wavelengths. Light at specific wavelengths will enter the body at different depths. And what it does is there's actually a cellular change that occurs. So the light energy gets absorbed by the cell, and there's the powerhouse in that cell called mitochondria. Mm-hmm. And what it produces is ATP. That's our energy that does all of our life functions. And typically in life, we eat our food, we breathe in our oxygen, they combine through a whole series of events to give us our ATP. But the problem is a lot of us don't eat great. A lot of us have a lot of toxins, or we're breathing in bad air, or we've got so much stress that we don't produce the kind of energy that we need. And what happens when you don't produce the energy, you become more vulnerable to certain illnesses or certain chronic type diseases. So laser energy enters the cell. There's a chemical reaction. We get more ATP production. What that does, some of the bigger things helps reduce inflammation. So whether it's an autoimmune or a localized bad shoulder, whether it's inflammation actually in the brain, which we see with dementia, Alzheimer's, concussions, post-traumatic stress disorders, the face as well. So whether it's, acne, psoriasis, rosacea. So there's so many things that we can do if we can get that light energy into the cells to, in essence, kick the body into high gear.
Okay, so what I'm hearing is it's really cell repair.
Yes.
Right? So it could be used with exhaustion. It could be used, I guess, with skin abrasions of any type. It could be used with pain to reconstruct something, right?
Yeah.
So if, when you were talking about the wavelengths and different wavelengths, is there different light therapies that you're giving depending on what people are coming in for? Is that how it works?
Yeah, good question. So a lot of people call this red light therapy, which, yes, there's red light involved in it. It's a little bit of a misnomer, but there's multiple wavelengths that can be used to heal certain parts of the body. Most of it is not, it's really a matter of depth of penetration. So that'll help determine what wavelength, what power, what intensity I want. So if I just want skin, so if I want acne.
Wrinkle, okay.
Yeah. So acne, blue light is great because the bacteria that causes acne is very vulnerable to that light. If I want collagen, more elastin in the face, red light is perfect for that because it's got a shallow depth of penetration. So all that energy goes just those first millimeter or two into the skin. If I want deeper penetration, then I'm looking at a different wavelength, 810, 905, 1064. And then I've got to determine, okay, what kind of power intensity do I need to reach that area? I mean, anybody could shine a red light on you, but it's not going to do anything unless it has the power to be able to penetrate further into the body. So there's a lot of parameters that are involved in this, and so it gets kind of tricky and dicey with all those things. But once you get to understand and learn how light therapy actually functions, then you got a better understanding. So a lot of times people say, well, will it solve fibromyalgia, or will it help with this name or Raynaud's disease or whatever? And I don't look at the name of it. I look at what are the symptoms. And most autoimmune, it's inflammation. I know we can go after inflammation. So yes, we're going to have success with that. Somebody has some type of let's just say Alzheimer's, or let's say post-concussion or depression. What do we know with those types? They all have inflammation in the brain. The cells are actually producing cytokines that increase apoptosis, which is cell death. So not good. And it's killing neurons in the brain as well. Hence why concussed patients, athletic, have a greater degree of dementia later on in life. Mm-hmm. Hence why they're using it in a lot of the professional sports now, namely football, as that's such a big issue. And it's all dealing with inflammation. We can also use it for red blood cells to gain more oxygen. So whether that is, again, an athlete or somebody who's trying to get more athletic, like we all are, if we can increase the oxygen in the blood, we can exert ourselves further. Also, that oxygen can travel to the brain, so it's getting the oxygen that it needs to be able to continue to survive healthily.
Excellent. So if someone's coming in for light therapy, how does it work? Is it more like a gun for a specific area? Is it laying on a bed? I can see a red light behind you. Is that one of your devices for giving the therapy?
Yeah, so I have a few different modalities. So yeah, behind me is the light bed. It looks like a tanning bed, but no UVA, no UVB. So there's nothing as far as danger to it.
Okay.
But you picture a tanning bed, but it's all encased in light therapy, two different wavelengths, 660, 840. That does a good job for the entire body, for systemic inflammation, for increasing of oxygen. That's, Dallas Cowboys have this, Phoenix Suns have it. Oh. I have one specifically for the face. So I call it the face spot, just goes over like this.
Okay.
3 wavelengths. It has the red, it has the blue, specifically for the acne, and it has yellow. And then I do local treatment as well. And so that's going to be more spot treatment that can get deeper into the body. So if I've got a rotator cuff issue, or if I've got a bad hip or a knee, I want to get as far in as possible. The other modalities are good. They have a systemic effect, but they don't have a deep penetration.
Okay.
So spot treatment puts more energy into that specific area, so I can get into the muscles, I can get into the joints, I can get into the cartilage, I can get into the bone as well.
Wow, that sounds pretty amazing. So I'm also hearing that going to a trained therapy specialist or whatever you call yourself is probably very smart to know the depth and what you need and the type of light. So you can't just go out and buy a red light or...
Well, you can always go on Amazon and get something for $100.
Okay.
So
much different is what I'm hearing.
And that's the tough thing is people say, wow, I'll be on the bed that I have is thousands and thousands of dollars. There's right. a reason for that, as opposed to $100 thing on Amazon.
Right.
So yes, there's a lot of things out there, and that adds to the confusion.
Okay.
But yes, it's important. I've been working in lasers and interestingly enough, the dental field, as I come from a dental hygiene background.
Okay.
So I worked with dentists with lasers. It wasn't just what we call photobiomodulation or light therapy, but we would use lasers to cut teeth, cut soft tissue, all kinds of different types of procedures that we would use with lasers or light therapy. So I've got a long history of that, and then I'm, certified laser therapist. as well as certified health coach. So there's a lot of things and knowledge that I can bring to the table so that when somebody comes in with certain problems, I can do my best to help guide them in the right direction. It doesn't mean that light therapy is a one-stop shop. Just like we go back to the photosynthesis with the plant. You can have all the sunlight in the world, but if it doesn't have good soil and nutrients, if it doesn't have water, it's going to suffer.
Right.
So what I like to do is work with the clients and guide them, not just light therapy, but guide them to, a nutritionalist or a chiropractor or a physical therapist or other types of people that can all work together to try to remedy whatever ailments they may have.
Yeah, I love the whole body approach. Love that. So if I was an athlete, say I'm running marathons or doing triathlons like I used to do, is something like light therapy something you do weekly, monthly, once in a while, or is it different for everybody? How does that work?
Well, it depends what they come in with. Twice a week is great. You could technically use this every day, but logistically wise, that can be difficult. So if I've got an athlete that comes in and they've got shin splints, which I had recently.
Oh, that's a good one. Okay.
Couple times a week. With this one client, it was one appointment and he was fixed. And he runs marathons.
Wow.
That was great. Doesn't mean that's going to be the case with everybody, particularly if you've got more chronic issues, that injury has turned into scar tissue, has turned into nerve type issues, then it takes longer. But for acute issues, 1-2 appointments, great. For longer, more chronic type issues, then we're looking at 6 to 10, maybe even more. And if there's, and then certain people that may have systemic issues, they may have deeper underlying issues. And what we want to do there is try to reduce the symptoms. We're never going to fix it, but we want to try to manage it. And so that may be an ongoing investment as far as once or twice a month, just to keep them at a healthier level. But for athletes, if you want to boost before a performance, you want to have more oxygen in your blood, you come in before. If you've had a really tough workout and you're feeling a lot of pain, you're sore, a lot of lactic acid buildup, you come in after.
Gotcha.
So again, everybody presents with different things, but for athletes, or again, those of us who are no longer athletes, but we want to still maintain some kind of level, but we're constantly dealing with aching pains, ankle, knee, whatever, and it's not allowing us to push ourselves to where we want to be. This is great. And the best thing is you can get off the meds in many cases. So a lot of people, they get a sore knee. What do? They pop pills.
Yeah.
Ibuprofen, or a lot of people, they're a lot worse. So the goal is here also is to be able to at least reduce any kind of medications that they're taking.
Love that. Well, this has been pretty fabulous and very enlightening too. Anything I forgot to ask you that you'd like people to know?
Well, important to kind of know what you're getting into when you come in.
Yeah.
So, quickly you come in, we talk about it. And again, I always give the first session for free because this is new to a lot of people. So I want them to feel comfortable that they can come in before they decide to make any kind of payment. Costs are really quite inexpensive, particularly compared to when you add up any kind of medical cost or ongoing pills. So a typical session when people buy like a package of 10 is $40 per session. And each session will last, depending on what modalities we use, anywhere from 30 to 50 minutes.
That's very reasonable.
So I think it's very affordable for people.
Very. And if people wanted to take advantage of this trial that you're offering, how can they find you?
So the website, it's a long one. It's LightPath2Wellness.com, and it's light spelled LIGHTTO wellness. LightPath2Wellness.com. The phone number is 833. If it's easy to remember, it's light NJ or 544-4865.
Excellent. That's fine. And those of you that are listening to this, Scott's information will also be in our show notes below. So you can either, if you didn't get to write it down and you're driving in your car and listening, you can go to our show notes when you get back and all of his information will be there. Thank you so much, Scott, for sharing your business with us and a little bit of your journey and what your modalities are all about.
Thank you so much for having me.
You're welcome.